The chiropractor, me.
It's much more flexible than I am.
But he's younger than us.
Yeah.
Hey everybody, it's Melissa Martinez from the Pulaski County Health Department, and it is Friday, so you know what that means.
Means it is Fit Friday.
Yeah, it means we're talking all things fitness. So today, guys, I have the blessing of sitting down with Dr. Roy from the St. Robert Chiropractic Center. He happens to be my chiropractor, and also he has helped me. You know, a lot of you know that I just turned 50. So our subject today, hitting on that, is the importance of wellness. It's the importance of getting things done to your body before they turn into nagging injuries or before they develop into pain and stuff like that. So that being said, I'm going to go through the 5 top reasons that people went to the chiropractor in 2020, and then I want you to talk about them. The first one is persistent back pain. The second one was nagging neck pain. The third one was car crash injury, recovery of whiplash. Number 4 was wellness and relaxation. And number 5 was improved physical performance by reducing injury, which is the main reason that I come. But let's hit on one first. What are the main causes you see of persistent back pain?
Typically, postural. A lot of postural, especially with this past year, 2020, a lot of people working from home, and they don't have a very nice, ergonomically correct workstation from home. A lot of people wore kitchen tables on bar stools and their couches, recliners, or even in their beds, and that prompted a lot of upper back and neck issues due to postural distortion, which happens a lot anyway, but especially this past year. That seemed to be the real big one.
That makes a lot of sense. So does the manipulation generally, does that do it? And then...
Yes, as far as help, yes. Manipulation, chiropractic manipulation is one of the best things for that. And retraining kind of the upper back and the neck muscles to kind of hold you into that correct posture while you're working. It reduces fatigue, reduces neck pain, shoulder pain, and headaches, for just to name a few.
Yeah,
so.
I could see the headaches. Are there like some top tips? Like if you had like 3 tips to give to someone, say they're working at home, the 3 things that they could do to help them?
Frequent breaks, honestly. If you're sitting for hours at a time, frequent breaks, take 5 minutes, get up, walk around, go outside, get some air, and really be conscious of posture. I always tell people in my office, you want to think about the back of your head. If you were to drop a plumb line, so to speak, from the back of your head, it should be sitting over your tailbone. So keeping this posture up and the shoulders in about midline. And that seems a little strange at first and maybe a little uncomfortable, but it will save you in the long run.
You know, I have a question for you on that too. That I want to hit upon. Would you say too that a lot of the reason that their posture's bad is because of weak core strength?
Yes, weak core strength is a very big one. Over the past 25 years that I've been in practice, I've seen a lot of that. And weak cores will lead to weak posture and distortions elsewhere in the spine that can cause problems. It's a trickle-down effect, really.
So a combination of the 3 of like changing up your work habits and the way that you sit and also working on your core strength would help alleviate a lot of that?
Absolutely, 100%. Yes.
Oh, I love that. I love that because honestly, I mean, I love that people can come in here, but wouldn't it be better if they didn't have to come?
That's ironically, that's really the ultimate goal.
Right.
Really, everybody walking around in a perfect world, but correct posture and a very strong core would be ideal. But we can help those things, and with the tips we give people, have pretty good success rate in correcting a lot of that.
I love that. So let's get on to number 2 then. We're going to talk about that nagging neck pain. What are some of the causes of that?
Well, it kind of goes back to number 1. Honestly, a lot of postural distortions. People with their necks are either too far forward or too far back when they're looking at their computer screen, especially from working from home. I always tell people, and this seems a little odd too, to keep the computer monitor fairly well eye level. It seems a little high, but you're not doing this. When you look down, you're taking the natural curve that is in the neck and slowly reversing it and stretching the postural muscles in the neck, and that leads to a lot of fatigue and headaches at the time.
So their monitor needs to be right here.
Yes, the neck curve has a pretty little slight backward C shape to it, and if you kind of think of it that way, maintain that, and keep the monitor eye level, that will alleviate a lot of woes.
That makes a lot of sense. So I'm just going to throw it out here. I'm going to guess that number 2 leads into number 3, and that's the headaches.
Yes, headaches. Headaches are funny. They're subjective, of course. You can't really measure a headache and how bad it is on an intense level. People take a lot of things for those: ibuprofen, Tylenol, Aleve, Excedrin, and there are many different causes for them. But in here, it boils down to the postural distortion and typically mechanical fault in the upper neck, usually. That manipulation, I've had very good success rate with that as well. But it's usually some kind of a mechanical fault, or maybe some lingering issues from an old car accident, whiplash injury, something like that, where the ligaments and the supporting structures of the neck have been distorted or stretched. But trying to restore that normal, it's all about motion. Doing it, to borrow from Newton, a body in motion stays in motion, you know. So it's all about maintaining the correct curvature and the correct motion in the neck, and make sure everything is as stress-free as possible.
I love that you said that, because I think we were talking earlier before we even went on camera that one of the top 10 reasons that people go to, and it wasn't on that particular article, or one of the top 10 things that causes, the back pain and stuff like that, is a sedentary lifestyle.
Yes.
So can you kind of talk about that, about the importance of moving at every age?
Exercise is huge. Movement. It's all about movement, really. Of course, rest is important as well, but there's a line. Movement, exercise, fresh air, and hydration are big. A lot of people, again, kind of maybe going backward a little bit with the headaches, dehydration can be a huge cause for that as well. And people don't drink enough water. We drink way too much soda, way too much everything else, and water. Water is huge.
Yeah,
So,
I've read a lot of studies on the effects of water, and it is a big deal, and it helps with your digestion.
Exactly.
Which I've read that chiropractic care can help with that as well.
It can. If you kind of, on a basic level, if you think about it, every organ, every muscle, every gland is attached to the nervous system. And the nervous system, the breaker box, if you will, is the spine. So everything branches off the spinal cord and the spinal column. So any kind of interference or mechanical fault with that can affect digestive issues. The peristalsis, or the movement in the digestive system, can cause GERD-like symptoms, reflux.
Really?
And all the leaky gut syndromes, that kind of thing. It's just, you can kind of go down a big trail with that. But
that is amazing.
yeah, the digestive system is run by, of course, the nervous system, and any kind of mechanical fault there can cause problems.
That's amazing. So I have a question for you on that. If someone were to come in, because now I'm interested, because I suffer just like everybody else with a lot of that stuff from time to time, and so you wonder, is it my the makeup of my back or whatever? If someone were to come in now, you can feel that if something's off, right? Even if they don't know it's off.
Right, exactly. X-rays, of course, you can determine that. You can see. It's kind of a feel you get after so many years of doing it. You can palpate the spine and feel for any kind of irregularities or any kind of distortions, be it forward or backward, or any kind of rotational malpositions that might be going on, and can put stress on the nervous system that leads to all of that.
So I have a question for you too. So chiropractic care is not just all about the back and the neck, right? I mean, there's a lot of other places that need to be adjusted, right?
A lot of other
things. Can you kind of
things,
talk about some of the things that could go wrong in the other parts of the body?
Ankles, knees.
Really?
Yeah, ankles and knees. I've a lot of old ankle injuries. Think about it, we're on our feet all day long, and any kind of odd motion in the ankle or the foot can cause knee problems, which can affect the hip. It's the old ankle bone connected to the shin bone connected to the knee bone thing. Yeah, it can affect motion all the way up.
That makes a lot of sense. So, so how would a person know if they needed some type of chiropractic care? Would they just kind of feel off, or maybe have some tingling, or have the headaches we talked about?
What brings them in most of all, well, of course, would be pain or back pain, typically. Numbness, tingling down the arms, down the legs. Headaches, digestive issues. There's all kinds of things, but typically we'll bring them in as back pain or acute, I lifted something too heavy and twisted, which is usually the typical sprain strain you would get in the lower back. But any of those things, I see them on a pretty frequent basis.
So if a person catches them early, let's say that they feel a little twinge, rather than letting it get really bad, because I've done that before. I'm totally guilty. But if people will come in at that first sign, it's a lot easier to treat. Am I right?
A lot easier to treat and much more effective. It's not we can clear it up quicker.
Have you seen it to where like someone has a small thing and it's a domino effect, and before you know it, and by the time they come in, it takes a long time to get them adjusted?
Exactly. Somebody comes in with like a chronic low back pain, maybe due to arthritic change, wear and tear that happens, that we all have. You and I are both
we're both
50-ish, right? Yeah. I'll leave that there.
You're getting there.
Right, yeah, I'm getting
You're
there.
behind me.
Yeah, but yeah, that can, say you have a upper back problem, shoulder issue. Well, that can in turn lead to headaches and neck pain, which can in turn lead to pain tingling down the arm. So it can be a domino effect for sure. Yeah.
Hey, so let's talk about pain though. Let's talk about, because generally what people do with pain is they head to their medicine cabinet. And people need to understand that those things that you're putting in your body do not come without side effects.
Correct.
Acetaminophen, all that stuff has an effect on your kidneys and your liver.
Yep.
And chiropractic care can potentially get them the relief they need without having to take that stuff.
Yeah. Short term, it's not going to be that bad. Tylenol is acetaminophen, which is Tylenol, ibuprofen, Aleve. But over time, and there's a warning on the bottle, over time you can cause significant liver damage, stomach lining issues, kidney issues for sure. Chiropractic can help, get you off of that train of having to take those every day. And then next thing you know, your liver enzymes are off the charts for some reason. Well, taking acetaminophen like it's in a Pez dispenser is not going to work for you. So
no, and I've seen a lot of people do that. I know athletes we're horrible about treating ourselves and running through pain and stuff.
Everybody seems to want a quick fix, especially athlete, you want to, okay, let's fix this, let me get back out there. Of course, I'm a sports nut, and I've played baseball when I was a kid, and I've always followed the Cardinals and the Blues, and I know the chiropractor who works for the Blues and treats a lot of the athletes. And the Cardinals utilize him, the Blues utilize him, the Rams when they were in St. Louis utilized him. So a lot of professional sports use them a lot.
Yeah, so let's talk about that in rehabbing injuries, because the chiropractic care, let's say you have hamstring strains, which people don't technically think to go to a chiropractor.
Right.
But there's all different kinds of injuries and stuff they can come in to get rehabbed from, right?
Hamstring injuries, as you know, right?
Yeah, I've been coming for a while for that.
Right. Hamstrings are big. Everybody has, in my experience, everybody has short hamstrings. They're tight. Hamstrings, if you think about some basic anatomy for a bit, the hamstrings attach on your pelvis. If they are really tight, well, that's going to affect the motion in the pelvis, which can affect tailbone, which can affect all the way up the spine. So there's that domino effect right there. So a lot of stretches for the hamstrings, the quadriceps is big.
I love that you said that, because we're going to hit on this next. So improve physical performance by reducing injury. So going to a chiropractor, that's one of the reasons I was really slowing down and not being able to really, having to really do a lot more intervals. And it was frustrating. So since coming back, definitely my form is getting better and everything like that. But it's not just for runners. I mean, chiropractic care is for anybody who wants to reduce injury and perform better, whether that be, we hit on this, some functional fitness, picking up the groceries, the grandkids. Yeah,
anything like that. We're all guilty of, I don't want to make more than one trip to the car, so you put, 8 bags on your arm and carry them into the house, and guess what? Your elbow starts to hurt, your shoulder starts to hurt, you wake up the next morning, you can't move the darn thing, So it's all about, it's physical performance and making sure everything is warmed up, stretched, and moving correctly. That's what you want. It's got to be. It's all about functional. If you go out with a cold muscle or something's really tight, something you haven't used in a while, like say you go out and you start bench pressing 180 pounds and you haven't worked out in 10 years, well, you're going to run into some problems. So, yeah.
So it's kind of like what I'm hearing from you, and what I'd like to really stress to people. This is all like a let's see. There's several different things. This isn't a fix-all cure. Cure. However, fit into your lifestyle and fit into your into your weightlifting regimen.
Yes.
Your stretching regimen, eating well, getting lots of water.
Yep. Yes. It all goes together. We're kind of partners in this whole thing. If you don't get on board with the whole, okay, this is what I'm going to do. This is the way I'm going to approach my life now, and start to eat right, exercise, hydrate, stretch correctly, low impact stretching like yoga, excellent. I'm a big fan of that.
Yeah.
And chiropractic care periodically for anything that may pop up. There we go.
So I love that. So guys, we are going to end it there, but we're going to talk about in 2021. I personally have incorporated this into my routine. This is something that I feel strongly about because it's helped me not to get injured.
Right.
And it's not for everybody. I totally understand that, but you agreed to give us some tips from time to time.
Absolutely, I will. Yes.
And especially, and guys, so this is to be incorporated into a healthy lifestyle, which we're going to be doing the whole month of January. We're going to be talking about nutrition. We're going to be talking about just things that we can do at any age to make 2021 a better year, healthier mentally, physically, spiritually, because
Right.
it's all a package deal, right?
Exactly. Yep.
Yeah.
Start the new year with a bang. Let's go.
I love that.
Love it.
I love that, guys. So Happy New Year.
Happy New Year.